It has still not sunk into people's heads that this is a disaster waiting to happen. This is a people's war. We know we are widely in stage 2, but serious doubt is that I think we are in stage 3.
Hello and welcome to the Indian Podcast. I am Anku Goel. Today we have with us Dr. Naresh Trehan, a man who needs no introduction. But I will be failing if I don't mention that it is indeed the renowned cardiac surgeon Padma Bhushan Dr. Trehan. He has seen cases and medical complications and public health crises in his career of many decades of having saved lives. Today we hear his views on current coronavirus pandemic and what's at stake for us and what's the logical sane step to safeguard ourselves. Listen in. Thank you so much, sir, for sparing time for our listeners here. To begin with, sir, in this pandemic situation, what do you advise the countrymen to deal with COVID-19, considering that even educated people are not necessarily using precautions or needing the government advice? What health warnings would you give as a very senior veteran doctor?
So this is the most disappointing part of our situation in India today, that it has still not sunk into people's heads that this is a disaster waiting to happen. And the most important thing is that they don't understand it's going to affect them and their families and their businesses. So to be not paying attention to all the warnings that have been given and now the Prime Minister, that doesn't get into your head, then I don't know what will. But there'll be a very heavy price to pay. Pay attention that we are all in it together. This is a people's war. So one point is very clear, that the first fight starts from each individual. Okay? That means if you protect yourself, hopefully you will not get the infection. And if you don't get the infection, you will not spread it to your family and your community. That is one as an individual. The responsibility of an individual is that if you have traveled overseas and come back within the last 14 days, you must report to the authorities. There is a helpline to tell you where you need to report, and say that you have traveled, and then all you have to do is to quarantine yourself. And if you develop the symptoms, then you need to have your tests done, and whatever needs to be done will be decided by the doctors. So that's the little responsibility of the person who's traveled. Then the next thing is that in case they have not quarantined themselves and they've been in contact with other people, then those contacts must be named so that they can be kept under surveillance, and they should also quarantine themselves, because that's the first line of defense. That has been breached by our travelers, especially not only Indians who came back from other countries, but travelers from other countries like Italy and Germany, and all those people have affected Indians while they were traveling around. Now, this has already happened. So now then that leads to stage 2, that we know we are widely in stage 2, but serious doubt is that I think we are in stage 3. Stage 3 means that it is spreading in the community at large. Now, how do you check that? You do that by community sampling, widespread, taking tests from anybody and everybody who has cough, cold, fever, taking their samples and seeing if it has spread widely or not. Then we have to come to the next stage, which is the more dangerous and challenging, is that a large number of people have contacted it and they start getting the severe symptoms of it. India's population is so huge that if large number of people do get affected, and 15% of them will require some hospitalization or something, there are not enough beds, there are not enough doctors, there are not enough resources in our country to deal with them. So that is why we are trying to stress and get into every citizen's mind that the government is doing a lot. They have shut down movie halls, malls, restaurants, all that stuff, inward travel from overseas. The government has taken some bold steps, which is very good. But then if we fail in our duty as citizens to help to mitigate this problem, then, like I said, it's basically anti-national, because it's a national problem. So now, if the time is still there, if we actually isolate ourselves into our homes and do not do unnecessary interaction in the public, in the next 10 days, 2 weeks, we should be able to break this cycle to a large degree and maybe save our country from the worst thing that happened like China or Italy.
So, very positive note there that you've said there are still hopes or possibility of breaking the cycle. Indian health infrastructure has always been a question there. We are in economic slowdown phase. How much will India be able to spend on building up the structure drastically as China did to contain it? How well are we prepared at this stage?
So there have been extensive discussions at the government level, at the private level, and interaction between government and private. The most efficient way of taking care of them is to identify COVID-19 hospitals so that everybody is in one location. So that if say you take Gurugram, right? We have a population of maybe 40 lakhs of people and in neighboring areas. So if we were to identify one hospital,
Hmm.
which like a government hospital or something that has been newly built but not commissioned yet, all the patients who are to be hospitalized go to one hospital, and the government and private providers can together take care of them in a way wherever help is needed. So supposing you need more ventilators and they're not available in the government hospital,
Sure.
and the private hospitals have it, we can share them. If you need personnel, if you need expertise, if you need medicines, all these things can be seamlessly shared between government and private providers for the larger interest of the country. But we must fight this battle together because otherwise, singly, neither the government nor the private sector can do anything effectively alone.
So when you
So,
talk about fighting it together, as you're suggesting, well, how will the private players work with the cost involved in it? How much can they take? Already we were going through the economic slowdown. We have this pandemic situation. Everybody is volunteering. How will it impact the industry if we have to even think about it at this point in time?
this is the biggest challenge right now, and we are actually just getting a grip on it. So the private providers are already skimming very close to the ground in a wobbly financial situation.
Sure.
So the government, instead of giving, like spreading money unnecessarily or not focused, the first thing, because we'll be the frontline fighters, the government and us, the health facilities and us, the private facilities, they are the ones who are going to have to fight this battle. Then we need to have enough resources to be able to get the equipment, the protective gears that we want, medicines, all this stuff, specialized ventilators. So I think the best thing to do is for the government to, one, make sure that whatever money is due to the providers, hospital providers, healthcare providers, from CGHS, ECHS, ESIC, PSUs, those should be expeditiously paid out so that the financial situation becomes a little stronger. Because right now we are worried about our payroll itself because all the regular activity of the hospital has come to an end. That is one. The other is GST. Relief from GST would be very, very important at this stage because we are paying 18% for GST, but we are not getting any set off because we don't charge the patients GST. So the government can temporarily suspend it right now, and then later we'll figure out whether it's permanent or not. So that way, there are many things that they can do to help the hospitals so that we can fight the battle stronger.
So can we get a sense that private hospital will extend some service at a lower cost, free of cost at least, to the low income strata, if that is to be
Yes,
considered?
as much as possible without closing down the hospitals, the private sector is willing to do. No question about that. We are very cognizant that it's a war against an invisible enemy. We must all fight together. And in this situation, it's not the army, but it's the doctors and the healthcare providers, the nurses, the technicians, and everybody else who are the ones who are in the front line. So we are there, but we need that oxygen supply from behind us to be able to fight the battle properly. It's like ammunition for a war.
So there has been a misunderstanding of the information by government, also by people, that some sectors have been kept out of quarantining, stating that essential. There are meetings happening to say whether it's at parliamentary level or banking space or essential sectors. Do you think this is also a space where we should now start controlling the gathering?
Like the Prime Minister put it quite interestingly, that it's a people's lockdown. So this is a very good thing, and I am hoping that we shall then be able to, in maybe a little lesser form, extend it for 2 weeks. So that all the people who can work from home, not to have to use public transport and all that, without, bringing everything to a major halt, we should be in one form or the other practicing an almost lockout so that we can actually break this chain. You see, if we take a 10-day, 2-week break in this whole activity level where people to people contact is reduced to the bare minimum, we can still prevent the infection from spreading widely. Because, when you're in a family unit, you'll realize who's got it and then report it, and it won't spread to the society at large.
So last question, a message for all the people who are still in the state of panic.
No, so you should be almost panicking without losing your head. Be serious, be responsible, and take the instructions properly and protect yourself and your family.
Thank you so much, Dr. Trehan, for sharing your word with us.
Thank you, bye.
So as Naresh Trehan says, if we have to win this invincible war for our country, we need to take 2 weeks strict break. Only then we can contain COVID-19 from entering into next stage. The best way is to not panic but listen to government instructions sincerely and implement them. Keep listening for more such podcasts on COVID-19.